Hello and welcome to Pregnancy Info. As you reach the end of your pregnancy, you may be feeling a mix of emotions about labor and delivery. Despite any worries about what lies ahead, you are almost certainly ready for your pregnancy to end. After all, this waiting you want to meet your baby. As your due date approaches, if you haven't gone into labor, you may be concerned. You might wonder if your baby is healthy, if your body is working properly, or feel like your pregnancy will ever end. What does it mean to have an overdue baby? With all the different dates and terms you hear during pregnancy, it may be difficult to determine when you can expect to meet your baby. The American College of Obstetricians and Gynecologists uses the following definitions: early term 37 through 38 weeks, full term 39 through 40 weeks, late term 41 to 42 weeks, post term beyond 42 weeks. Babies born before 37 weeks are considered premature, and those born after 42 weeks are called post-mature. About 60% of women will give birth on or before their due date. Only about 1 in 10 babies is officially overdue or born beyond 42 weeks of pregnancy through. How are due dates calculated? The actual date of conception of a baby is hard to know, so gestational age is the common way to calculate how far along a pregnancy is and predict your due date. Gestational age is measured using the first day of your last menstruation period. 280 days or 40 weeks from this day is the average length of the pregnancy. This is your estimated due date. What causes a baby to be born later? Why is your baby deciding to take a little longer to be born? Some common reasons include: this is your first baby. You may have a history of giving birth to postpartum babies. Your family has a history of giving birth to postpartum babies. You have obesity. Your baby is a boy. Your due date was incorrectly calculated. What are the risks of an overdue baby? When a labor extended beyond 41 weeks and beyond 42 weeks, there are increased risks of certain health problems. Some of the most common risks associated with a postpartum baby are: number 1, fetal necrosomia, or being significantly larger than average of birth, which can also increase the risk of cesarean delivery, or shoulder dystocia post-maturity syndrome, characterized by baby not gaining weight past their due date, as well as dry or loose skin and long fingernails and toenails at birth. Low amniotic fluid, which can affect a baby's heart rate and cause the umbilical cord to compress during contraction, resulting in a lack of oxygen flowing in the fetus. Meconium in the lungs of the baby, which can lead to serious respiratory problems. Stillbirth, when a baby dies before delivery. Late-term and post-term pregnancy can also involve delivery complications like severe vaginal tears, infection, postpartum bleeding, or hemorrhages. What will happen if your baby is overdue? If your baby due date has come and gone, you can rest assured that you will continue to receive medical care. In fact, you will probably have more visits each week with your midwife or OB-GYN than you previously did. At each of your appointments, you can expect that your doctor will check the size of your baby, monitor baby's heart rate, check baby's position, and ask about baby's movement. Your doctor may suggest some extra monitoring and medical tests to make sure that your baby is healthy. They will ask you to be extra vigilant in performing kick counts, record of your baby's movement. Testing may occur once or twice a week and can include: number 1, non-stress test. This makes your baby's heartbeat for a period of time, usually around 20 minutes. Contraction stress test. This measures your baby's heartbeat when the uterus is contracting to determine if there is fetal distress. Biophysical profile. This involves a combination of monitoring the fetal heart rate and an ultrasound exam. This combination of multiple tests allows a doctor to check the fetal heart rate, movement, and muscle tone. Amniotic fluid level can also be assessed during the ultrasound. Cervical exam. The manual exam allows the doctor to determine the condition of the cervix. The cervix fully dilates and effaces during labor, so your doctor will look for signs of ripening and other changes that may indicate labor will begin soon. Depending on the results of these procedures, your doctor may decide that it is the best interest of you and your baby to induce labor. If your doctor or midwife would like to induce you, there are many things you can do to help nudge your little one along that range from more natural methods to medical procedures. Some methods of induction with varying effectiveness include exercise, sex, nipple stimulation, castor oil, acupuncture, acupressure, membrane sweeping, breaking of your bag of water, medication. You should have a discussion with your provider about which methods make sense in your particular situation. Most babies are born within a few weeks of their due date. If you find yourself nearing the end of your estimated due date window with no signs of labor, there may be actions you may take to help nudge your baby into the world. Before doing so, you should always consult with your doctor or midwife. They can discuss the benefits and risks of your specific health situation and offer guidance on the safest ways to help your little one arrive in your arms. Hope you have find this video useful. Must share it with your female friends to help them to know about what to do after no labor pain passing due date.